One of the most common knee injuries that we come across these days is patellar tendonitis. Activities like climbing stairs, walking around, jogging, running, jumping, or playing any sport could be really troublesome if you are going through patellar tendonitis. Now, majorly, this happens because of overuse around your knees or maybe lack of activation of the surrounding muscles around your joints area. So, let me first break it down what exactly patellar tendonitis is. Patellar basically is one of the largest sesamoid bones around your knees area. So basically ये जो knee joint है यहाँ पे you have a sesamoid bone which is connected to a muscle tissue. So अगर आपको कोई inflammation है tendons में, so that is known as tendonitis. So when it comes to patellar tendonitis, you can understand in a simple way कि there is an inflammation around the kneecap area, because patella is also known as a kneecap in simple words. So you have inflammation around this area, and because of that there will be a lot of issues when it comes to doing flexion of the knees. So जब आपको patellar tendonitis होगा तो you will realize that you are having pain in day-to-day movements जैसे walking, running, sprinting, walking around the stairs, or maybe it could be something where you're sitting down on the chair or sofa as well. So this is one injury which really needs to be looked upon. There are some preventive measures which I'm going to talk about today, along with some necessary drills which you can add as a part of your rehab. In simple terms, patellar tendonitis is also known as jumper's knee. So now, as simple as that, you might be having pain in very basic movement like flexion of the knees, as in there is a bending of the joint angle around the knees area, and you might have a certain kind of stiffness, you might be having a little swelling in the knees, or maybe a lot of pain around the knees. Now the best way is to get a diagnosis through a physician, maybe a sports physio or maybe a general physician, to know whether you are having this injury. So there are a lot of drills which can be added in this particular injury. Let me show you all of them. So the rehab process for patellar tendonitis or the preventive measures include some of the drills, which includes the strengthening of your knees and particularly the activation and strengthening of the muscles around the joints. For example, you have quads, you have hamstrings, you have glutes and calf muscles which need to be trained properly, and at the same time there has to be certain drills and exercises to make sure that they are strengthened and activated. So I'm going to quickly show you a few of the common exercises which can be done to make sure that you are activating and strengthening the knees. So first one is terminal knee extension. I've tied this band on the ankle and I've gotten into this loop band. Okay? So this is my affected leg. What I'm going to do is I'm going to extend and then slowly flex it over here. So you can try this. Let's move on to the next exercise. So the second exercise is isometric quad contraction, or you can also say short arc quad. So let's say my right knee is affected. So what I'm going to do over here is I'm going to keep this foam roller here underneath my leg or around the knees area, the back side of the knees, and you can also keep a wet towel or a thick foam or something to make sure that there's a slight cushioning around the knees area. This is here. The left one which is not affected is around 90-degree angle, and I'm going to keep this heel placed over here on the floor, and then I'm trying to activate the quads. I'll press it through my knees, but I'll try to activate the quads. Okay? And then I'm trying to also, when I'm pressing it and trying to activate the quads, my focus is on the quads. So I'll try to hold for a few seconds, and my toes will be dorsiflex, as in it will come closer or maybe pointing towards the shins area, like this. Slow, 1, 2, 3, 4, 5. So third exercise is single leg raise, where my affected leg will be straight over here. This is the affected one, right one, and left one is at 90 degrees. So when I raise the leg up, slowly it should be through the quads. It should not happen majorly through the hip joint, but my focus should be on activating the quads over here. So I'll show it again. Ankle dorsiflex, and I raise it with my quads being activated, and then I'll try to hold it for a few seconds here. 1, 2, 3, come down, and then again I raise it up. And if you want to know more of such exercises and drills, watch out for the upcoming videos. So I'll be coming up with more videos on this particular topic with related to drills and exercises in the form of shorts. So keep watching, guys, and thank you for liking and commenting on my previous videos. I would also suggest that you subscribe and also put on the notification bell so that whenever next time I'm coming up with the videos, you can watch it soon. Thank you.